Hi, my name's Tony Okalawan. I'm actually a physician over at Brigham Women's Hospital, and today I'm just going to do a short session on putting in IVs, primarily in the adult population. Perhaps if I have more time, I can also discuss pediatrics, but right now we'll just talk about the adults. So I'm just going to use my right hand to kind of demonstrate from a visual perspective. Obviously, if you're a practitioner, the very first thing is to wash your hands and, of course, put on gloves. There's two things that you need. Mainly, you need a tourniquet as well as an IV set. Obviously, as you are preparing, the biggest thing is really to set yourself up for the first opportunity that you could actually get an IV in. IV meaning intravenous, so you're trying to get into the vein to hook it up to something, whether it's a bag of fluid or whatever it may be, in terms of medications and things that you need for a patient. So, again, demonstrating with my right hand, primarily the easiest vein is actually what's called up here, which is your cephalic, and cephalic meaning top and head. And the best way you could do is on your radial side. So if you could see, if I was holding up my hand, there's actually a vein that's like right here. We call this, back in med school, it's called the intern vein, meaning people who are novices and putting in IVs the first time, to somewhat boost their confidence, we try to give them the easiest chance, and usually that's what we call the internal vein, or actually cephalic vein here. So apply the tourniquet. Typically you would like to do a little bit more distal to kind of like where the elbow is for around this vein, but some people also do further distal up here on the upper arm. Regardless, the idea is to turn the tourniquet and make it tight enough so that way you could pull the blood as a patient who's using the gravity is allowing the blood to pool, okay, and that makes the vein itself pop out more, makes it more easy to visualize on any type of skin tone. And as they're pumping, a few times, you're also cleaning the area, make sure that the area that you're going to enter is sterile, okay, and you've put on the gloves, you've done everything, and you get the catheter out. And again, since I don't have anything with me, I'll just kind of describe the motion. You go to basically a 45-degree angle as you enter the surface of the skin. Again, ideally you are seeing the vein. If you're not, you can track and see kind of a little bit more. Again, this is distal, meaning towards my shoulder. Proximal is towards my fingertips. So you'll likely see the outline between proximal and distal of the vein, and as you enter a 45-degree angle, you angle down, you should see the catheter will flash and then enter in as well. And then that's what it is, and you're able to hook it up, put some tape, usually a tegaderm as well, and you should be good to go. But always remember to take off the tourniquet, so that way the blood can actually flow back to the limb. Thank you for your time.